Hi, this is Jill Hayden at Dalhousie University in Halifax, Canada. I'm a reviewer and an advisory board member within the BAC review group, as well as a co-convener of the Prognosis Methods Group. I'm really sorry that I can't be there with you in person today, but thanks to Andrea and Moritz for allowing me to briefly introduce the topic of prognostic systematic reviews in the Cochrane Library. I'll talk a little bit about what is prognosis and how is prognostic evidence, how it can be useful. Types of prognostic research questions, as well as some of the prognostic activities within Cochrane, including the history, the new exemplars initiative, and particularly is relevant to the Cochrane BAC review group, and some methodological challenges and ongoing methods work related to prognostic systematic reviews. This will be followed by a discussion amongst yourselves about prognostic reviews in the Cochrane Library. So first off, what is prognosis? Prognosis is the probable course or prediction of a specific outcome in a health condition over time. Prognosis studies are aimed at understanding the course of a health condition, its determinants, and/or the probability of an outcome. And this information is useful to provide information to patients about how they're going to do, possibly to define target groups for specific treatments, which is of interest to us in back pain, as well as to identify important prognostic factors and possibly to target these for modification. The Progress Group has identified 4 different types of prognosis studies. This includes first average or overall prognosis, prognostic factor studies, risk or outcome prediction modeling studies, and treatment effect modification studies. I'm going to talk briefly about the first 3, which are the topics for the 3 ongoing Cochrane exemplar prognosis reviews. So first, average or overall prognosis. Studies on overall prognosis estimate the overall course of a defined health condition or disease. This defines the prognosis of people in a particular health context and may be defined for subgroups with a health condition or according to particular demographic or clinical characteristics. For example, I may be interested in knowing the overall prognosis of elderly females with acute nonspecific low back pain. The second type of prognosis study are prognostic factor studies. These focus on the factors, the prognostic factors. The aim of these studies is to identify specific factors that are associated with subsequent outcomes in a health condition or a disease. Evidence about prognostic factors may help to identify targets for new interventions that aim to modify the course of the disease. They may enhance the design or the analysis of intervention trials, and they may inform the development of outcome or risk prediction models. The third type of prognosis study that I'll describe is outcome or risk prediction modeling studies. These studies identify formal combinations of multiple prognostic factors from which the risk of a specific outcome can be calculated for individual patients. Outcome prediction models are also called prognostic models, clinical prediction rules, or predictive models. The steps of an outcome prediction model include development, validation, updating the model, and quantifying the impact of the model. I didn't need to go very far down in a simple PubMed search to find plenty of back pain related examples of prognostic reviews, where the title suggests that each of these types of prognostic questions have been answered. For example, it seems that this paper, Clinical Course of Nonspecific Low Back Pain, is a review of overall prognosis for primary care patients. And here I found a prognostic factor review, looking at a single prognostic factor construct, catastrophizing for back pain. And this is another study that appears to be a prognostic factor review, this time investigating all of the factors for a particular topic area, factors associated with persistent problems after whiplash. And finally, an example of an outcome or risk prediction modeling review. Notably, these are a rarer type of review to see in the back pain literature. We have hundreds of different outcome prediction models that have been published, but rarely is it that they're replicated, and few have been repeatedly validated and have gone any kind of impact evaluation. StartBack likely now has enough primary study evidence that a systematic review may be helpful for that question. And so now to tell you a little bit about what's going on in Cochrane related to prognostic reviews. The Prognosis Methods Group started off as a group of, I think, five or six of us talking about prognosis and prognostic systematic reviews at the 2004 Cochrane Colloquium in Ottawa. Subsequently, the Prognosis Methods Group was registered as an entity within the Cochrane collaboration in 2008. The main objectives of the Prognosis Methods Group are to work with existing Cochrane entities, including methods groups, to make sure that the best use of prognostic evidence is done in Cochrane reviews, and also to conduct research to advance the methods of prognosis systematic reviews. In 2013, the steering group approved the proposal by the Prognosis Methods Group to work toward registration of 3 prognosis exemplar reviews on each of the 3 different types of prognosis studies that I talked about. These 3 prognostic reviews are representing each of the types of prognostic questions: overall prognosis, prognostic factor studies, and outcome prediction models. The prognostic factor review is being conducted with the support of the Backer Review Group. The outcome prediction models review is being conducted with the Anesthesia Review Group. And a review of overall prognosis is being conducted within the Cochrane Developmental, Psychosocial, and Learning Problems Group. The goal of these exemplar reviews is to assess the feasibility and to provide some examples of these innovative types of systematic reviews. And alongside the reviews themselves, methodological work is being done about each of the types of prognostic questions that will inform future prognostic systematic reviews. And in this way, we're helping to develop a process for conducting innovative Cochrane reviews. The protocol for the prognostic factor review was recently published in the Cochrane Library in early September, and so you can all take a look at that. This review, titled Individual Recovery Expectations and Prognosis of Outcomes in Nonspecific Low Back Pain, is being conducted by a team of investigators, including myself, Michelle Tugas, Richard Riley, Ross Isles, and Tamara Pincus. The objectives of this review are to synthesize the evidence on the association between individual recovery expectations and disability outcomes in nonspecific low back pain. We're also exploring some heterogeneity across how the prognostic factors expectations is being measured, as well as within different populations. A secondary objective is to conduct some methodological work on how to conduct prognostic factor systematic reviews. The status of this prognostic factor exemplar review is this. We registered the title in 2013 and subsequently received funding from CIHR to conduct the review. The protocol was submitted to the back group in July of 2013 and was just recently published in the Cochrane Library. The delay that we saw there was due to multiple reasons, really. There were many rounds of revisions, both within the Cochrane back group editors, as well as going through an editorial process through the Prognosis Methods Group and approval from Cochrane Editorial Unit. As well, there needed to be some new processes to generate a flexible review type in order to publish this type of review within the Cochrane Library. Our expected timeline for completion of the review and related methodological work is for September of next year. A little bit of background about the review. The rationale for this question as an exemplar review was supported by several things. First off, as you know, back pain is an important health condition. Expectations is also a current concept within the field, and it's in line with a patient-focused or patient-centered research approach. It's also potentially modifiable, providing an opportunity for relevant clinical messages if appropriate. Expectations is also a complex concept. It's well supported by relevant theoretical literature and provides us with an opportunity to explore different measurement approaches of the prognostic factor within the review. Risk of bias, including potential confounding, is also important in this review question. And we also know that studies are available. There are 3 existing systematic reviews on the topic. However, we do know that each of those reviews only identified approximately 30% of the available literature. So we know there are sufficient numbers of longitudinal studies that will allow us to conduct a meaningful synthesis on the topic. The available studies on this topic also represent different phases of investigation, from exploratory to confirmatory, allowing a nice example systematic review. And so what are some of the challenges of prognostic questions? Well, first, the quality of the available evidence has limitations. Prognostic studies are observational in nature, making them more open to potential biases. And it's most common to see exploratory studies in the literature asking prognostic questions, more likely leading to reports of spurious associations. Particularly so for the back pain field, relevant subgroups have been difficult to define for a clinically useful definition of populations. And there are numerous potential prognostic factors. We've seen more than 200 different prognostic factors that have been explored within low back pain prognostic literature. And so there are also methodological challenges for conducting prognostic systematic reviews, which really should follow the same steps as intervention reviews of defining the question, conducting the search, selection, data extraction, risk of bias assessment, synthesis, and interpretation. There's limited consensus and limited methodological guidance available on how to conduct systematic reviews of prognostic questions. And we know that there are limitations in many of the available published prognostic reviews because of inconsistent indexing and prognostic language in the health literature makes it really difficult to identify these prognosis studies. Furthermore, there's not clear criteria for selecting the studies within a prognostic systematic review and how to assess the risk of bias. We've done some initial work with the QUIPS tool in assessing risk of bias in prognostic factor reviews, but there needs to be some more work to really understand the potential impact of biases on the results that you see in a prognosis review. Furthermore, there are some challenges around interpretation of the results. The grade tool was developed for intervention reviews and will need some modification to interpret the strength and quality of the overall evidence for prognostic questions. So with that brief introduction, I'll open up the topic of prognostic systematic reviews for discussion amongst yourself. Thanks to Andrea and Moritz for leading the discussion, and I'm really sorry that I can't be there. If any of you would like to, please contact me directly if you have any questions or you'd like to discuss this topic further. Okay, have a great day, everybody.